Hello and welcome to lecture number 2. Today we are going to begin discussing the first hard tissue of the tooth, which is enamel. I am Dr. Hibel Zer, and I hope you will enjoy this lecture. We will discuss the physical properties of enamel, the chemical composition, and finally we will discuss the histology of enamel and see some histological slides. Enamel, which is the hardest tissue in the whole body, is the hard tissue that covers the tooth and can be seen in the oral cavity. This tissue withstands shearing forces. Shearing forces are forces that work, two forces that works in different directions or opposite directions. Also, it withstands impact forces, like the force that happens during occlusion. It has high resistance to abrasion. Abrasion means loss of tooth structure because of friction with a hard object other than other teeth. The thickness of enamel varies from up to 2.5 millimeters in the cusp area to be a feather edge at the cervical margins. In primary teeth, where the thickness of enamel is almost uniform, it is about 1.3 millimeters. Enamel cannot be repaired or replaced because the cells that secretes enamel, which are called the Amyloblasts, they perform apoptosis after they finish secreting enamel. The enamel has low tensile strength, or in other words, high modulus of elasticity. Both means that the tooth cannot resist the forces that tend to pull it apart, which means you can easily break enamel. That's why it requires the support of the resilient dentine. Without this support, enamel is easy to break, or in other words, it's brittle. The surface enamel is harder, denser, and less porous than subsurface enamel. Why? We will come to that in the histology section of this lecture. The hardness and density decreases from the cusp tips to the cervical margins. Young enamel appears white, turning to a more yellow appearance as translucency increases with age. The chemical composition of enamel. Enamel is composed of 96% inorganic material, 2% organic material, and 2% water by weight. The inorganic composition is the same in all the hard tissues of the tooth. It's calcium hydroxyapatite. The difference is in the size of the crystal and how does it form or bind to each other, and also to the calcium and other minerals composition inside the crystal. The organic composition, we have free amino acids, small molecules, peptides, large proteins complexes like amelogenins and non-amelogenins. The enamel hydroxyapatite crystal are about 70 nanometers in width and 25 nanometers thickness, almost the full thickness of enamel actually. Most crystals are hexagonal in cross-section, as we can see here. The core of the crystals are rich in magnesium and carbonate in comparison to the peripheries. And the length of it, sometimes the whole length of the enamel. Each crystal unit has a hydroxyl group surrounded by 3 calcium ions, which are surrounded by 3 phosphate ions. 6 calcium ions in a hexagon enclose the phosphate ions. The crystal is made of a repetition of those planes of ions side by side in a stacked layers. Some substitutions of ions and minerals can happen in the human appetite. The main substitutions that can be seen are the hydrogen phosphate and the carbonate ion can substitute the phosphate ion. Also, strontium, barium, lead, sodium, potassium, and magnesium can substitute calcium ions. Furthermore, fluor, chlor, bromine, iodine can substitute the hydroxide ion. The ions present in the enamel, the kind of ions, can influence dental caries by affecting the dissolution of the apatite crystal and the remineralization. For example, fluoride incorporation in the crystals inhibits caries. The carbonates incorporation in the crystals promote the carious attack because it makes enamel more soluble. Water is present in enamel in 2% by weight, 5 to 10% by volume. Water presence is related to the porosity of the tissue because it can be found between the crystals surrounding the organic component. It can be trapped within the crystalline defects, forming a hydration layer. Ions such fluoride travel through the water component. The organic matrix. So mature enamel has 1 to 2% organic matrix. That varies from 0.05 to 3% depending on the regularity of the crystals. Of course, immature enamel has higher and higher percentage of organic matrix. This organic matrix consists of proteins that are exclusively found in enamel. 90% of them are called amelogenins, 10% of them are non-amelogenins. They do not contribute to the enamel structure. The highest concentration of proteins in enamel is found in a structure called tufts that is found at the dentino-enamel junction. We will see that in the section of histology. The lipid content is 1% by weight of enamel. And it may be there because it's a remnant of cell membranes that form the enamel. You will be introduced into these membranes and how did they form the enamel and the tooth in the embryology lectures. So first, we are going to talk about the amelogenins. Unfortunately, these information are to be memorized. There is not a lot of things to understand in the components of the organic matrix of the enamel. So I hope you will be patient till we start discussing the histology of the tissue. So amelogenins are hydrophobic, they have low molecular weight, and they aggregate into clumps. They are produced by amyloblasts, which are the cells that secreted enamel, as I have already mentioned. They spread throughout the whole developing enamel, resulting in a gel matrix, through which the molecules and ions spread. This helps in the formation of large crystals afterward in the mineralization stage. All these stages will be given to you when we discuss amelogenesis in the embryology lectures. The non-amelogenins, such as daphtylene, amyloblastin, and enamelin, they have low molecular weight. They are derived from plasma albumin. They contain distinct components secreted by amyloblasts, and they may have a role in mineralization along with amelogenins. Do you remember this slide I showed to you last lecture? It talks about how can we study different tissues in the oral cavity. So we can use the ground section where the organic substance is burned and the inorganic substance remains. So due to the high mineral content of enamel, 96%, it is totally lost in the demineralized section, as we can see here. So enamel structure is mainly studied in the ground sections. Immature enamel can be studied in demineralized sections due to its high protein content, around 25 to 30%. As you will be taught in the amelogenesis lecture, the enamel formation starts with a matrix, an organic matrix, which is mineralized in a second stage. That's why the immature enamel, which is not yet mineralized, has a high protein content. The basic structure unit of the enamel is called the rods or the prisms. Each prism consists of several million hydroxyapatite crystals that are packed into a long thin rod, 5 to 6 micrometer in diameter and up to 2.5 millimeter in length. As you can see, these are the rods cut in a cross section or a longitudinal section. Prisms, this photo is taken by the electron microscope on in a higher magnification. So the prisms are separated by what we call the interrod substance here, where crystals change direction and deviate 40 to 60 degrees, leaving some space for organic material to accommodate. A higher magnification here. Prism boundaries reflect the sudden change in crystallite orientation. We will discuss that again in a few minutes. The prisms have a slightly undulating course that reflects ameloblast path during secretion. In cross-section, the enamel prisms take different shapes or patterns. The keyhole pattern, pattern 3, predominates. The prisms have head and tail region. The tail of one prism lies between the heads of two adjacent prisms. Maybe it's hard to you to see it in this section, but in a few minutes, the head and the tail, I will show it in another section in a few moments. An abrupt change of crystal orientation of the prism boundary is responsible for the optical appearance of the boundary, which means that the boundary looks a little bit darker than the inside of the prism. This section shows us how the prism takes undulating and wavy course. So the black prism comes from here, but it ends coming up from here. The gray one comes from here, comes up from here, the white one, and so on, because the ameloblast takes this undulating course during secretion of enamel. As you can see here in cross section, there is the keyhole pattern here, and it's different, it's wider when we cut in different angles, getting much wider when you cut in a wider angle. So the keyhole pattern can be seen here very clearly. There is a head and a tail. The tail is between two heads. The crystal's direction in the middle is different than the boundaries. The crystals deviate at the boundaries, as I have just explained. Also, the crystals in the middle or in the head has a different angle than the tail. The crystals in the tail also deviates. These deviations at the boundaries gives us this darker color of the pattern that makes us able to recognize the pattern. It's parallel to the long axis in the middle, in the head, and deviates, as I have said, at the boundaries. Here, it's easier to understand how the shape is different according to the cutting angle in cross-section. When we cut in 90 degrees angle, we get a perfect keyhole pattern. As we go from 90 to 0, the shape of the keyhole becomes more and more circular until we don't have a pattern anymore. We have almost 4 patterns of the enamel prisms in cross-section. The keyhole, the almost circular, the stacked pattern in which all the prisms are stacked above each other, and the one that has no pattern. Every 10 to 13 layers of prism follow the same direction, but the blocks of prisms above it and below it follow a different path. This gives rise to a banding pattern called the Hunter-Schrager bands. They are approximately 50 micrometer in width and are visible due to light reflection in different directions. So it is an optical phenomenon. In the outer quarter of enamel, all prisms run in the same direction, and so there is no banding. The prisms or the prism bands that are cut longitudinally are dark and they are called the Perizones, while the one cut in transverse are light and they are called the Diazones. The angle between them is 40 degrees. This pattern actually strengthens the enamel against fracture. In the cusp areas, as we can see here, the space for the prisms is a little bit tighter than in other areas. So what happens is the prisms over these areas, they become twisted, as you can see here. They are twisted around each other in a complex arrangement that we called gnarled enamel. The outer surface layer of enamel, about 20 to 70 micrometer in secondary teeth, is aprismatic. The crystallites are aligned at right angle to the surface and parallel to each other. That's why the surface layer is more highly mineralized than the rest of the enamel. This is attributed to the absence of prism boundaries where the organic material is located, as I have mentioned earlier. Enamel, as much as any other hard tissue in the tooth, is formed in increments because of periods of activity alternating with periods of inactivity. This results in what we call incremental lines. There is lines that represent short periods of activity, we call them the Crosstriations, and there is lines that represents long periods of activity, approximately weekly, week or 10 days of activity, that's called the Enamel Straya. So the Crosstriations. The Crosstriations appear as lines crossing the enamel prism at right angle to their long axis. So what we are talking about is these lines that are crossing enamel in a right angle. They reflect a diurnal rhythm, or in other words, a daily increments of growth. They are 2.5 to 6 micrometer apart. They are closer to each other near the enamel dentil junction, and they may represent variations in the organic matrix, or the crystal orientation and composition, or prism width. Again, they are these black lines that are crossing enamel prisms in right angle. The enamel stria or stria of Ritzius, they run obliquely across the prisms, as you can see here. They represent incremental lines that are approximately represents a weekly or a 10-day period of activity. In this section, as you can see on the surface of enamel the cells that are forming the tooth, which are called Amyloblasts, which means this tooth is still in early stages of formation. And the enamel here has high organic matrix percentage. In a cross section, like the one we see here, this is the enamel, this is the dentino-enamel junction, and this is the dentine. So the stria of Ritzius run circumferentially like rings of tree, as you can see them. These are stria of Ritzius. There are 7 to 10 cross-striations between enamel adjacent stria. So each two stria of Ritzius has 7 to 10 cross-striations between them. The enamel stria are 25 to 35 micrometer apart in the middle portion, where the cross-striations are 4 micrometer apart, and 15 to 20 micrometer apart cervically, where the cross-striations are 2 micrometer apart there. On the surface of a newly erupted tooth, the stria appears as fine grooves running circumferentially around the crown, as you can see in this picture. They are called perikymata. Perikymata grooves, where the perikymata ridges in between. They are removed after eruption by attrition and abrasion. Attrition is the loss of tooth structure that is caused by confronting or friction with other teeth. The neonatal line is one of the incremental lines that shows us difference between the enamel formation before and after birth. So we call this prenatal enamel, and this is postnatal enamel, which are of course different in composition. The surface enamel, as we have already mentioned, physically and chemically differs from subsurface enamel because it's harder, less porous, less soluble, and more ready opaque. More ready opaque means that it's whiter on X-rays. It's richer in trace elements, especially fluoride, has less carbonate, it's aprismatic, therefore highly mineralized, as I have explained in the past slides. We can see some phenomena on the surface enamel. For example, on protected areas of enamel, small pits could be seen on the surface. They are within the perikymata, and they mark the end of amyloblasts, where the amyloblasts were actually sitting on the surface before they committed apoptosis. They are 1 to 1.5 micrometer in depth. Also, we can see something called enamel caps. They are small elevations, 10 to 15 micrometer across. They result from enamel deposition on top of debris. That happens late during tooth development. When those caps are removed for one reason or another, we see something called focal holes, which are depressions in the surface. This happens due to abrasion or attrition. Also, on the surface enamel, we can see something called enamel rocks or brocks. They are elevations on the enamel surface, 30 to 50 micrometer in diameter. They have radiating groups of crystals, and they are more common in premolars. So as we go deeper and deeper in enamel, we reach the enamel dentine junction, In the areas where shearing forces are high, like beneath cusps and incisal edges, the enamel dentine junction has a scalloped shape or pattern, but in lateral surfaces it's more smooth. The enamel dentine junction is less mineralized than the enamel and the dentine. On the dentine enamel junction, we see multiple phenomena. Among them is the enamel spindles. Enamel spindles are narrow round tubules that are 8 micrometer in diameter, and they are actually odontoblastic processes that are extended from the dentine into the enamel to reach sometimes 25 micrometers of the enamel length. As I will discuss in the dentine lecture, the dentine is composed of tubules that are lining an organic matrix. Inside these tubules, we will have the odontoblastic processes that extend sometimes from the dentino-enamel junction into the enamel. The odontoblasts are the cells that forms and secretes dentine. These enamel spindles are most commonly seen beneath cusps because of crowding that makes the space less for the odontoblastic processes and pushes some of the processes above the junction. Also, at the dentino-enamel junction, we can see what is called enamel tufts. As we can see, tuft means something that looks like grass. They have the same direction as enamel prisms because they are a component of enamel. They are hypomineralized areas that shows residual matrix proteins. As we mentioned earlier at the beginning of the lecture, they have high percentage of organic matrix. Tuft protein is a minor non-amelogenin protein. They occur almost at a 100 micrometer interval. Another structure that can be seen in the enamel and at the dentino-enamel junction is the enamel lamella. It's a structural fold that runs the entire enamel thickness, from the surface to the dentino-enamel junction. They are hypomineralized areas because incomplete maturation of groups of prisms had happened there. As I have mentioned earlier, that enamel has some kind of microporosity. The enamel pores are water-filled spaces between the crystals. They make 3 to 5% of the volume of the enamel. Larger pores are found at the prism boundaries because, as we have seen in the slides and in the pictures, at the boundaries of the prisms or the crystals have deviation in the angles at the boundaries and at the tail. There is another junction between the enamel and another tissue. It is the cementum, in what we call the cemento-enamel junction. The cemento-enamel junction has 3 patterns. So, pattern 1 is where the cementum overlaps the enamel, which happens in 60% of the cases. Pattern 2 is where the cementum and enamel meets at a butt joint, which happens in 30% of the cases, like we see here. Pattern 3 is where the enamel and the cementum fails to meet and there is exposed dentine between them. Another pattern, the 4th pattern, that is very rare, around 1.6% of the times, the enamel actually overlaps the cementum, sorry. All these patterns may be present in a single tooth, but in different areas. I will show you more slides about the cemento-enamel junction in the lab section of enamel. What happens to enamel with aging? So enamel wears slowly with age, depending on the diet and habits. It darkens in color because of the reduced translucency of the tooth as secondary dentine forms and enamel thins. We will discuss secondary dentine in the dentine lecture. Because of the accumulation of surface coatings and stains, the people who smokes a lot and drink a lot of caffeinated beverages, they have darker teeth. The composition of surface enamel changes as a result of exchange with oral fluids. As we have discussed, it depends on which ions are substituting the ions of the hydroxyapatite crystal. So if it's fluoride, it will be more resistant to caries. If it is carbonated, it will be more prone to caries. There is a decrease in caries due to enhanced mineralization. I just have said it depends on the diet, the pH of the mouth, and the kind of substitutions that happened in the crystals. A final phenomena that is maybe interested for you is what we call enamel pures. They are small droplets of enamel on the root near the furcation because sometimes in the stage of teeth formation, some of the cells that forms enamel just slips down a little bit into the root and continue to form enamel there, to form enamel pures. How does that happen? What is Hertwig's root sheath? You will be introduced into that in the embryology lectures. That would be all for today. Next step is to see the laboratory section for enamel, where I will show you a lot of histological slides to review and discuss the histology of enamel that we have discussed here in the theory part. I wish you all the luck. Bye bye.